Days now, nurses and clinical officers in Kenya have been on strike, paralysing health services across the country. Doctors, through their union, the Kenya Medical Practitioners, Pharmacists and Dentists Union, called off their strike, their three-day strike on the 24th of December 2020. Now, that came as a sigh of relief to many. But we are not yet out of the woods, as their colleagues have remained adamant that they will remain on strike until their demands are met. But is there an inter-cadre fight, particularly between doctors on one hand and nurses and clinicians on the other? And with lab technicians set to join their colleagues in the strike tomorrow, the 20th of December, what next for the health sector? Grace Korea spoke to both KMPDU and the Kenya National Union of Nurses officials and filed this report.
Wanjiko has for 3 weeks now bore the brunt of absent nurses and clinical officers in hospitals. And just a few days ago, doctors too were on that list. She is waiting for the day their demands will be met. How soon or not too soon that will be, she knows not. But there is more to the grievances the more than 30,000 nurses in the public sector represented by the Secretary General have.
Yeah, we have had these issues for a very long time. It's a historical injustice that has been happening for a very long period of time. Nurses feel that they are the people who do the dangy job, but when it comes to payment and even administrative positions, they are reserved for doctors.
We are not being favored. None of us is being favored. It's only that the demands that we had set up to be fulfilled. Government engaged.
Questions have also been raised as to why it is taking too long for the cadres on strike to get the government's attention, or is it to reach a consensus?
And the reason why they have a CBA is that even when they are on strike, they are negotiating with their colleagues, who are most likely beneficiaries. So if you are negotiating on behalf of government and you are going to benefit, definitely ensure that the deal is good.
As doctors, we're not going on strike because nurses are going on strike. We're not going on strike because clinical officers are going on strike. Then they decide to go on strike because we are going on strike. We were doing joint negotiations. Then we realized, we cannot agree. Some of the things as we can take them, they can't take. So we decided to chart our path.
They have ended their strike so that they continue working in their clinics as we continue fighting.
Panyako further blames the government, particularly Health CS Mutahi Kagwe, as the reason the negotiations collapsed.
I have a feeling that CS Kagwe has a wrong attitude toward nursing as a profession. That is why he has never made this union, and we hear through our own sources on how he comments about nurses. He has very negative comments about nurses.
A record 34 nurses have unfortunately succumbed to COVID-19, with many other healthcare workers getting infected and passing on.
When you assess the level of risk, it is understood all over the world. Even WHO recently said that nurses are the most high risk to getting nosocomial infections. But when you come on the ground, when it comes to remuneration now and compensation, it is skewed, it's inverted.
We are not in a contest of who is more exposed or who is not exposed. All of us as healthcare workers, we are exposed in equal chance.
As nurses, once we are out of the hospitals, they also close down. Everything's closed down. There's no services that can take place without nurses.
We can't work without nurses, we can't work without clinical officers, they can't work without doctors.
Now, it remains a wait-and-see situation. Who will surrender first? Will it be the government or the nurses and clinical officers? Keep in mind that lab technicians will down their tools tomorrow, Monday, the 28th. Grace Korea, KTN News.
Right, who will blink first? We wait and see. I want us to quickly take a short commercial break here on Checkpoint. When we get back, a special report on the Kenya National Union of Teachers, the membership numbers and the controversies